Welcome back in. Well, if you're a parent, at some point, you've likely taken your child to the doctor a time or two for an ear infection. There are a lot of conditions when it comes to the ears, nose, and throat. Dr. Jonathan Grischkan is with us from Nationwide Children's Toledo, so we can learn a little bit more about that. It is Kids ENT Month.
That's right.
Yeah, so we want to raise a little bit of awareness about that. I think, yeah, when we think the ENT, we think ear infections in kids, but there's a few other conditions as well. What are some of the common ones?
So, yeah, as you mentioned, ear infections are probably the most common thing, and snoring and nasal obstruction. Sleep apnea in kids is very common, so those are probably the two most common things we see. Anything in the head and neck, basically regarding airway obstruction. Hearing loss is a big part of our practice, so children with congenital or acquired hearing loss and requiring either surgical or hearing aids. Breathing problems, that's kind of my area of interest. So we're involved with, essentially everything in the anatomic region of the head and neck.
Yeah, all of this. So what are some symptoms that we should look for? You mentioned snoring. Mm-hmm. That could be indicative of something.
Absolutely. So if kids are snoring or they're having trouble breathing at night, you hear them stopping breathing or choking or gasping, those are kind of signs of sleep apnea that you can, that we don't diagnose as sleep apnea without a sleep study. But those are symptoms that would be concerning and should be, something to discuss with our pediatrician and potentially come see us. That's one. So ear infections and hearing loss as well. So those are probably the two.
Those are the big ones. Mm-hmm. Yeah. So at what point, though, do you go from seeing just your pediatrician to needing to see a specialist?
So there are some guidelines as far as when to refer, when the pediatrician should refer. We do see kids who have felt or their parents have felt like they maybe waited too long. So I always tell parents to advocate for their kids and really be an advocate so that if they feel like it should be something to call our office and come in or call their specialist and come in. Yeah.
So and I think sometimes as parents, we want our children to be healthy, but sometimes we don't know, the doctor said this, or,
Sure.
so, but advocate for your kids.
Absolutely.
So that's really good advice. And, is there a certain number of, my kid has had 3 ear infections, it's time, or 7 ear infections? Is there a magic number?
Sure, there are guidelines, and they're guidelines, so they don't, they're not rigid, but 3 infections in 6 months, 6 in a year, hearing loss, and fluid in the ears for more than 3 months are sort of the ear tube or ear infection guidelines that should prompt a referral to a specialist.
Yeah. Do you still take out tonsils and all that stuff?
We do a lot of that. It's still probably not as common as in the past, but
okay.
It's still probably the 2nd or 3rd most common surgery in the United States.
Yeah, so tonsils, adenoids, all,
ear tubes, yeah.
Any, as you said, anything in this region. But what is the benefit, though, of parents taking their kids to see a pediatric ENT versus an ENT that also treats adults?
That's a great question that I'm going to answer with a question. Why wouldn't you?
Sure.
I guess is how I would say it. Pediatric ENT specialists, we've essentially done a normal otolaryngology or ENT residency training, which is typically 5 to 6 years, and then dedicated an additional 1 to 2 years of pediatric specialty training. So when you have the opportunity to see somebody who has essentially dedicated their career to treating kids only and having the kind of ancillary staff, nurses, and all of that, and the support system for that, I would think if you have the opportunity to do so, why would you choose otherwise?
Right, and you have one here in Toledo.
Right. And we have a group here that, we have 24/7 coverage here. We have a group here that's here all the time and available, so.
Yeah, I think this time of year, too, there's a lot of stuff going around, and it's, my kid has a fever, but maybe it's just the flu or it's this or that, but maybe it is an ear infection, or maybe those types of things lead to those ear infections. So it is important to make sure our kids get in and they get treated. Yeah,
absolutely. Yeah. And hand washing. I can't advocate it more. Wash your hands. Keep your hands away from your face. My kids hear me say it every time, and they roll their eyes. But really, kids are in daycare. There's lots of germs. Kids are at school. There's lots of germs. So hand wash, hand wash, hand wash.
Yes, and I've heard a lot of kids have gone down in the last.
It's hit our household recently.
Yeah, right. So please wash your hands. But great information though about ear, nose, and throat, because I do think, a lot of kids they get ear infections or the tonsils and all these different types of conditions. And as you mentioned with the hearing, that's huge as well. I didn't even think about that. So.
And one of the things I always tell parents is we're always happy to evaluate your child and see if they need something. we're not technicians, so we'll see you, discuss it with you, and see if they need something. It's not that you come to see us and they're going to get surgery.
Right. It'd be great. And hopefully, maybe not, you know, and wouldn't that be something?
If needed. Right.
If needed. Wonderful. Doctor, thank you so much for
problem.
being here
Nice to
today.
meet
We
you.
appreciate it. Yeah.